Hello Tam, hope you're all doing good. Guys, there is a query about like how to finish the information reading in 2 minutes if they have given more than 2 or 3 papers. Okay, so this is a very valid and a genuine concern. So how would you be able to do that? As there is always when they have given even 10 or 15 papers, there will be one slide which is a master slide, okay, where they talk about what is the patient name. This is a patient simulated task, what is a patient name, and they would have given some history and they would have told you what you are supposed to be explaining the management, or you are supposed to be revealing the news and discuss the management part. And then there will be domains which will be given. That is called the master slide. Okay, so that is called the master page. So when you have in 2 minutes, even if you spend 30 seconds reading that and understanding what is the whole task inside 10 minutes, what I need to be doing, so you can write down, because you will get a paper pad and a pencil or a pen, write down in bold letters PST or ST, that's patient simulated task or structure discussion, the patient name, the age, okay, and write down, okay, management or diagnosis, whatever the thing they ask you to do, and look, just have a look what are the domains you have been tested for. Then you go for the other ones. Once you understand what is a concept, there could be triage document, there could be investigations, there could be scan reports, they could give you the summary. For example, if it is a Charcot-Marie-Tooth disease with obesity, they would give everything about Charcot-Marie-Tooth disease. The thing about part 3 is if they give you a new disease, they will give you a lot of information on that. Okay, so the first and foremost part is read the master slide, go through the roughly scan through the investigations, and then if any additional information. And all these papers are there on your table as well. So you can go through even inside the cubicle. So once you understand this, then you can go inside and start. But if you think you want to take more than 2 minutes, it's absolutely okay. Just have a look, but do not get panicked, because after 2 minutes, everybody enters. If you're still there, then you try to get panic. All right. So you tend to get very tense. Don't worry. Just read the document carefully and then go inside. And inside one cubicle, you sit down. Once you ask the history, and if you still want to go through the document, you can just say, can I have a look into your investigations, please? And have a look. Tell and then have a look. Okay. So it's a very, very doable thing. So one thing is, at a glance, you need to know what it is. For example, CTG, at a glance, you know whether it is abnormal or whether it is a normal. And when you see a scan, you know what is wrong. So do not keep on pointing the things. And if the blood investigations are given, see if that is anemia, means whether it is microcytic, hypochromic, or macrocytic, or how is the platelet. So just have a look. If blood group is given, just make sure. And very, very, very important, check the name of the patient, whether it is the same on the investigations as well as on the master slide. Okay, these are the smaller things, but they do take, sometimes they can, for the patient safety, they can give you different report, and once you say it is different, they can give you the correct report, right? So all those things you need to keep in mind. And how do you practice? Now I said how you have to go about. How do you practice reading them so quick is when you read an information leaflet. Okay, so take a timer of 2 minutes and try to flip through them. Okay, so in that way, and after 2 minutes, you just think, what did you analyze while reading? Okay, it is all about training your mind to read quicker, training your eyes to read quicker, training your mind to analyze what you're reading. And it's a very, 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 very easy one if you start doing now. The more you train the mind, the easy it would be. So you won't get panicked even if it is 10 or 15 papers, right? You guys are all used to reading such a long EMQ, so it won't be an issue. So you can do that, but just train your mind. All the very best, and hope these steps help you. God bless you. And if you have any doubts, if you want to ask anything about part 3 preparation, just drop your message in the comment box. I'd be happy to help you. Thank you, guys.